My name is Ken Yamashita of the ACAP, the Planning and Training Department. Now I moderate from now. Today, we have two speakers for session 2. Dr. Dorota Jarosinska, WHO Regional Office for Europe, European Center for Environmental Health, WHO, and Dr. Hiroaki Minoura, ACAP and Nagoya University of Commerce and Business. At the end of each presentation, we have 10 minutes for Q&A. So all of you are more than welcome to raise your questions or shape your thought, share your thought and feelings via a Q&A box. The presentation today focuses on the adverse effect on human health by air pollution from the viewpoint of epidemiology and experimental evidence. Especially, Dr. Jarosinska will also explain the interlinkage between science evidence and policy formulation in Europe and WHO activity, including the history of WHO guideline 2021, which is the latest environmental standard of air pollution. Then we'd like to invite Dr. Dorota Jarosinska, WHO Regional Office for Europe, European Center for Environmental Health, WHO, to run the work of the task force on health under the Convention of CLRTAP and relevant work of WHO beyond cooperation with CLRTAP. Dorota Jarosinska, MD, PhD, is a specialist in public health, working for nearly 30 years on the health and environmental issues. At the WHO European Center for Environmental Health in Bonn, Germany, she manages a program on living and working environments, which covers topics of air quality and health, health aspect of climate change mitigation, chemical safety, environmental sustainable health systems, environmental noise, and occupational health. And she is chair of the Joint Task Force on the Health Aspect of Air Pollution under the UNECE LRTAP. She coordinated the project on the development of WHO Global Air Quality Guidelines, which are published in September 2021. Prior to joining WHO, she worked for 9 years at the European Environmental Agency on environmental health issues. So, Dr. Jarosinska, the floor is yours.
Thank you very much, Dr. Yamashita. Good day, good morning, dear colleagues, dear participants. I hope you can see my screen. Please confirm. Can you see my slides?
Yes.
Okay, thank you very much. So thank you for inviting me again to this seminar to share some of the experiences from Europe of the work of the World Health Organization, in particular in the context of the Task Force on Health. As stated in this kind introduction, I work in Europe and I am part of the team of the European Center for Environment and Health. We are serving 53 members of the European region, but are developing work which is of global relevance, working for the countries in relation to reviewing the evidence, developing policy advice, and advocacy. When it comes to the topic of air quality and health, also our work is covering the whole spectrum with the common goal to bring this health argument across and to the fore, especially in the context of intersectorial debates, where many of the measures to improve air quality are decided upon. So this work includes these reviews of scientific evidence, and the best example is the case of air quality guidelines, but also developing different methods and tools, again, to strengthen this health argument, working with countries, with the experts from the health and environmental sector, and also a lot of advocacy work. This work as part of WHO is guided and is contributing to several global and regional relevant policy frameworks. So first of all, in 2015, there was the first resolution of the World Health Assembly on air pollution and health. Then our activity is also an integral part of the general program of work of WHO, and we expect it will continue in the forthcoming program of work, also because the topic of climate change and health will feature there prominently. And there is also a dedicated global strategy on health, environment, and climate change. In Europe, additionally, we have a platform called European Environment and Health Process. This platform is in place for more than 30 years now. And this is a platform through which the ministries of health and of the environment of the member states of the WHO European region work together on environment and health issues and air quality, both ambient and indoor air quality features prominently on this agenda. One of the relevant dimensions of our work and platforms through which we work on air quality and health is the task force, the joint task force on the health aspects of air pollution. I think you have already seen this graph, which is showing that also our task force is just one member of the family of dedicated task forces and groups that work on different dimensions of the effects of air pollution, in our case on health and on other components of the environment in case of other task forces. And this task force has quite a long history, was established in 1998. And from the beginning, this task force is chaired by WHO, by our center, and it brings together representatives of the parties to the convention, again, representing both the environmental and health sector. So again, intersectoral platform to work on certain topics. In this case, the emphasis is on the health effects of transboundary air pollution. And I can only say that recently there is also an increasing interest in assessing and considering the synergies between air quality and health agenda, climate change, especially mitigation agenda, and also recognition of other dimensions of environmental challenges like loss of biodiversity. Task force works through regular task force meetings and implementation of the work plan. Just to give you a sense of how this work is organized, these annual meetings discuss different aspects, policies, sharing country experiences, giving updates and progress of in research. Also, an important and of sustained interest topic is the question of risk communication and public health messaging related to air quality information. And these reports from the annual meetings and presentations, they are available on the website of WHO Europe and UNECE on the convention websites. Just to give you an example, this year we had, after the COVID break, the first physical meeting with different presentations. We were also very pleased to welcome presentation from this particular network and the presentation of Dr. Yamashita. But beyond the meetings, of course, there is the work plan. And as I mentioned, that the task force is just one member of the family. It's also that our work plan is part of the work plan of the whole community, the working group of effects and other. And we are expecting the adoption of these new work plans in December this year. Just to say that this work plan of this community working on the health aspects of air pollution it evolves around three big topics, and I would like to give some examples related to this. So one is around consolidation of the existing evidence on the health outcomes of exposure to air pollution. The other block of work on evidence then translating into policies. This is around methodologies and tools, and then the considerations of capacity building at different levels. When it comes to this work on consolidating scientific evidence, just few examples, air quality guidelines, and I will say a few words more about it. A year ago, also a technical report reviewing the health effects of airborne polycyclic aromatic hydrocarbons was produced by the experts working in the frame of the task force. And also as a spin-off of the development of air quality guidelines, we are now finalizing a technical report, which is a product of a rapid expert consultation of several air pollutants, especially heavy metals and methane and benzene, that were not part of the revision of the global air quality guidelines, the issue of 2021, but which were considered in the earlier editions of air quality. We expect to have this report published by the end of this year. Zooming now into the guidelines, because as rightly stated, this is really a landmark set of recommendations being picked up in different member states and in different constellations in the policy world. WHO has been publishing air quality guidelines since 1987. And before this edition from 2021, the previous one was published in 2005. And of course, since then, many things have changed. First, we have a lot of new good quality studies, evidence coming from different regions of the world, different exposure levels, context, studies working on big data, multi-center studies. Also, thanks to the development of air quality monitoring systems and modeling techniques, we have gained much better insight into the global concentrations of certain air pollutants and the air pollution levels. Also, these abilities to estimate the magnitude of the burden of disease due to air pollution has advanced, and you would for sure know that we are talking about several millions of deaths attributed to ambient and household air pollution globally every year. Also, this persistent issue of inequities, both in exposure and in impacts. And then more from the policy side, we saw that these 2005 air quality guidelines were really picked up in the policy world, so that this update was needed. And also that the issue of air pollution as a public health challenge has been increasingly recognized in the policy world. I mentioned the resolution of the World Health Assembly, but also resolutions under UNEP and the UNGA. So what are the guidelines? I think it may be useful to remind that the guidelines are not legally binding air quality standards, but this is a set of recommendations developed based on a very systematic and structured review of the evidence. So these are health-based and evidence-informed recommendations which serve as a reference point for setting policies, setting standards, developing action plans. The guidelines apply to ambient air and to indoor air. There are some exceptions that they don't refer to occupational settings. They still are very much focused on the single pollutant basis, and this is what was feasible based on the available evidence. And the guidelines are exposure focused, so they do not cover any recommendations related to interventions. How the guidelines were developed. I think this process-oriented information is of relevance because this is also showing the robustness of the ultimate recommendation. So in the process of developing guidelines, there are several dedicated groups. One, which was the group called Guideline Development Group. There was a dedicated separate group of experts conducting systematic reviews of evidence, and also the group of external reviewers and WHO staff. So when the first group's guideline development group working with WHO was established, they defined the scope of the guidelines and formulated the questions for systematic reviews for specific pollutants, specific health outcomes, populations to be considered. And then experts who were forming this systematic review team were conducting systematic reviews for these defined questions with meta-analysis. Then, of course, this assessment of the certainty of the whole body of evidence. So whether this certainty, the trust in this evidence, it's very low quality, low, medium, and high. And there is a dedicated assessment framework called GRADE. This is the framework recommended by WHO because all these processes, they are prescribed in the special WHO handbook for the guidelines. Because of the nature of the evidence considered in the context of the guidelines, some adaptations of this GRADE framework were necessary. And then when this body of evidence was gathered, Guideline Development Group developed also a process, 8-step process to derive air quality guidelines based on these reviews of evidence. And these 8 steps, they are all described in the document. And then this was the basis to formulate these recommendations, that is, these air quality guideline levels. All these individual systematic reviews of evidence were published in the special issue of Environment International, and also certain methodological work that was necessary, that is this adaptation of this GRADE framework, as well as a dedicated tool to assess risk of bias in these studies. They are also published and are available for everyone. So these are the guidelines. I am sure that many of you are familiar with those. So these values in green, these are new air quality guidelines for these 6 pollutants considered. In addition to these ultimate air quality guidelines, there is also a set of these so-called interim targets. This is a feature introduced already in the 2005 edition. And the reasoning behind was the following, that especially in the countries and regions with high air pollution, this gap between the reality and the ambition of air quality guidelines is so big that setting any policies and targets directly to air quality guidelines, it would feel almost impossible. So these interim targets are these steps to support countries in this process of the gradual improvement of air quality, gradual reduction of air pollution, which ultimately should lead to the achievement of air quality guidelines. And these values marked in red, these are 2005 air quality guideline levels, which now became new interim targets. And a very new feature in these guidelines are the descriptive, qualitative, good practice statements for certain types of particulate matter. This is ultrafine particles, black and elemental carbon, and dust and sand particles. And when the guidelines were developed, the experts were also reviewing the available evidence, but the conclusion was that it was not possible yet to derive this numerical air quality guideline level for those types of particulate matter. So these good practice statements, they refer to the feasible improvements, advancements in monitoring, in also mitigation measures that can be implemented, as well as some indication for the future research. I mentioned that the guidelines are not legally binding standards, but are a reference point. And as this presentation is also on the science policy interface, a very relevant in Europe example of the use of the guidelines is the ongoing process of the revision of the ambient air quality directives of the European Union, which explicitly refers to WHO recommendations and the ambitions that the revision of this directive should align these legally binding air quality standards with the guidelines. And last year in October, a proposal of this revision was presented by the European Commission, and the process of discussing it continues and is expected to be concluded by the end of the year. And of course, there are many actors, many stakeholders commenting. I just would like to use the example of the recent decision result of the voting of the European Parliament, and this voting took place in September, where the European Parliament was voting a number of amendments, proposed amendments to this revision of the directive. And the message is that in the Parliament was voting in favor of making some provisions more strict, making this air quality legislation even more stringent, more close to the guidelines. Of course, the Parliament is not in the deciding part, but it's just to give you a sense of where the process is now. Of course, these discussions about using the guidelines as a reference is also taking place in individual countries, but I'm bringing this example. But this work on reviewing the evidence is not only the guidelines. As for the guidelines, there were these systematic reviews of evidence conducted with the concentration response functions included. We are also working now as WHO and within the task force on the project called RAPI2. RAPI stands for the project Health Risks of Air Pollution in Europe. This project, and which you can see the cover page, was conducted and reported in 2013. And this set of concentration response functions that for specific health outcomes and pollutants were used in the cost-benefit analysis in the context of the European Union, but also beyond. And because of this advancement in science, because of the work on the guidelines and the new research coming up, there is, of course, a need to revise and to provide a new set of concentration response functions for this type of assessments. This RAPI2 project is ongoing, and this is also coordinated with another project, which is led by WHO headquarters, by WHO Geneva. This other project is called EMAPEC, and it has a similar scope, but it is global, and it focuses on the morbidity as health outcomes, not mortality. And this, as I mentioned, this RAPI2 project is an ongoing activity. It will also be implemented as part of the work plan of the task force. And the focus for RAPI2 project is on mortality. It's on the CRFs for particulate matter, nitrogen dioxide, and ozone. And while this RAPI2 is meant to be more European focused, of course, it is coordinated, and we work with those experts who are involved in the EMAPEC project. And we hope to have results by the in this coming biennium of the task force work plan. I mentioned also the work on ozone and health. I will not go into the details, but it's just to signal what topic has been brought in the discussion within the task force on health as the area of interest to look and to conduct an exploratory analysis on the recent developments in this area. It's still a little bit vaguely described, and we will see whether it would be feasible to start this work already next year. It's the matter of also of resources, both human and financial. But I just wanted to signal what topics are of interest in the context of the task force. Moving now from these reviews of scientific evidence to the work on developing methodologies and tools. Of course, these things are not completely disconnected, but it's more for operational purposes. So as WHO and under the task force, we intend to continue working on different tools, in particular two tools, one called RQ+, which is focusing on the quantification on health risks and on health impacts of air pollution, and a new tool, CLIMAC-H. I will say a few words about it, which is bringing together air quality and climate change mitigation and health agendas. And as already indicated earlier, also in the context of the task force, this need to look into the linkages and synergies between the climate change mitigation and air quality and health agenda is increasing. And this is also reflected in the interest and wish of the task force to come up with case studies that would be looking into the health co-benefits of this trade and also existing trade-offs between climate change mitigation and clean air agendas. So these two tools, this AirQ Plus tool is the relatively easy to use software, very popular. We are very, as WHO, proud of this tool because it's really widely used in member states, in Europe and beyond. And this other tool, Climate Age, is a new one. As I said, this is linking the climate change mitigation and air quality because it is calculating the health and also economic gains of reducing national greenhouse gas emissions as described in these nationally determined contributions. And this effect is mediated by the changes in air pollution, by improvements of air quality. The tool is there, but ahead of us is now the task also to build capacity building programs and to promote the use of this tool, even though already there are some individual case studies developed using that software. So having the reviews of evidence, having tools, another line of work to translate this evidence into policies and actions is the work with member states. So it's these capacity building activities. And these activities, for us, they focus on the countries of the European region. And these are trainings related to the uptake of the tools, the ones that I mentioned, but also after the publication of the guidelines, we hold several, and we plan to continue more science policy dialogue. So using the guidelines as a starting point for the discussion about the country priorities, country needs, whether it's more about new revising air quality standards or more building capacities in the health sectors, or bringing and realizing the synergies between air quality and climate change agendas. That, of course, differs by countries. And while for the AirQ Plus tool, we have a developed curriculum that we applied already in some trainings. We, of course, need to continuously revise and update them to make them relevant. And for this climate age, we are ahead of developing such a training curriculum to increase uptake of the tool. And we are also, as the task force, part of the initiative undertaken under the umbrella of the convention, the ambition to develop the e-learning on the effects of air pollution, and we will be contributing with the part on the health effects. An important part of building capacities, but also awareness raising and information is, again, the availability of this evidence-informed guidance. And there are different aspects of it. On one hand, this is information and advice on possible dispersonal interventions and risk communication activities. And also, when talking about capacity building, increasing or facilitating access to the existing information. Because when we developed the guidelines, of course, the questions were coming, and so what? How can we translate it into action, into improved at large air quality management in the countries? And on the other hand, we are aware that there is a lot of tools, checklists, instruments, documents, guidances produced by different UN agencies, by different European entities, because this work for us is more regional. So we decided, working with experts from Europe, to develop a so-called resource package. It's a very operational online document with many links structured around these key components of the air quality management and organizing the available published tools, documents, guidances developed by the relevant entities so that people working on the topic can find more easily access to this information. And this document was published last year, end of last year, and we see that it is being used by the country. So this is also one of the ways of supporting putting these new guidelines in action in the countries. When it comes to this public health messaging, this and risk communication, this is a topic which recurrently gets back to us in the discussions of the task force when we work with the countries. And one aspect of this is also the use of air quality indices. They are gaining popularity. It's just one number, one value, one color, not looking into specific pollutants. And there are also these associated health messages. And there is quite a big diversity of these air quality indices, and also a remaining issue around the validation and the value of this public health and health messaging. And to this end, more than a year ago, we commissioned a review of this risk communication around air quality indices in Europe. And this review again confirmed this big diversity, and the conclusion and kind of a consideration for the future is that these health messages, they need to be based also on of course, they have to be based on evidence, but also their development and formulation should be consulted with interested users, patients, experts. And what's important, that it needs to be done at the local level. So it's not a desk exercise only based on the common knowledge and common sense. And that when wanting to use these air quality indices as risk communication instrument, so the instrument that would really drive a change in behavior will be used in this sense, a number of aspects need to be considered, aspects that are assessed locally. This is the line of work that we will be continuing around this. As I said, given a lot of interest, popularity of air quality indices, and need for improvement of this messaging. And the very last slide, I started saying about these global and regional policy platforms to which our work contribute, and I mentioned this environment and health process. And we had just this July had the next ministerial conference under this process. And of course, the work on air quality and health remains one of the regional priorities, and very explicitly it is the declaration is stating about the relevance of leveraging the existing platforms like the task force and the work of the convention to pursue. So we have a lot of evidence, we have platforms, we have interest, and we still need to do a lot to get the air quality that would be good and healthy for all of us. So thanks a lot for your attention.